Breathing. It's the very first thing we do when we come into this world, and the very last thing we do when we leave. It's so automatic, right? We hardly ever think about it. But for millions of people, every single breath is a real struggle, a conscious fight. So let's dive in and really try to understand what that fight is all about.
I mean, just think about it for a sec. That feeling you get after sprinting to catch a train or hauling groceries up a few flights of stairs. That burning, desperate feeling in your chest where you just can't get enough air in. You know that feeling, right? That little moment of panic before it all settles down again? Well, that is the daily reality for people living with chronic respiratory conditions. That struggle for them isn't just a brief moment, it's their constant state of being. Today, we're going to break down some of the most common of these conditions and see what's really happening on the inside. So, first up, let's talk about chronic obstructive pulmonary disease, or COPD for short. The name itself kind of gives you a big clue. Chronic means it's here for the long haul, and obstructive means something's blocking the airways. The real problem here is air literally getting trapped inside the lungs. And what's the number one cause of this blockage? Just look at this number. Up to 90% of the risk for getting COPD comes from one single thing: tobacco smoke. And that includes smoking yourself and being around secondhand smoke. It's a hugely powerful link and one that's preventable. Okay, so what exactly is COPD? It's what we call a progressive disease, which means it gets worse over time. The airways get blocked up, making it really, really hard to breathe out fully. And because you can't push all that old air out, it gets trapped, which leaves less room for fresh oxygen to get in. In this image, wow, it really shows you what living with COPD can look like. It's so much more than just being short of breath. It's being so wiped out that simple things like walking to the mailbox are exhausting. It's having that constant nagging cough. And look closely, it's having to use other muscles in your neck and chest just to help with the basic act of breathing. But COPD isn't just one single thing. It's really an umbrella term for two main conditions. On one side, you've got emphysema. This is where the tiny little air sacs in the lungs actually get destroyed. They lose all their stretchiness, kind of like an old rubber band. And on the other side is chronic bronchitis, where the airways are always inflamed and churning out this thick, goopy mucus that just clogs up the works. And this is where it gets really interesting, because these two forms lead to these classic, kind of memorable patient profiles. For emphysema, they're often called pink puffers. They stay pink because they're working so hard to breathe, puffing with pursed lips, that they manage to keep their oxygen levels okay, but they're often really thin because it takes so much energy. Then you have the blue bloaters with chronic bronchitis. The mucus blockage means lower oxygen, which can give their skin a bluish tint, and they might look bloated from other related complications. All right, let's switch gears to our next condition. We're moving from a problem of trapped air to a problem of an airway that's always on high alert. We're talking about asthma. So if COPD is like a permanent roadblock, think of asthma as more of a temporary one that can be triggered. The two big words here are inflammation and hyperresponsiveness. Basically, the airways in someone with asthma are just super sensitive, and when they get exposed to a trigger, they completely overreact. The muscles clamp down, the lining swells up, and mucus floods the area, suddenly making it really hard for air to get through. Which, of course, leads to the big question, right? If the airways are so over-the-top responsive, what are they responding to? What is it that flips that switch and kicks off an attack? Well, the answer is a whole lot of things. We call them triggers. And a lot of them are common allergens you see right here: pollen, dust, mold, pet dander. But it's not just allergies. An asthma attack can be brought on by a cold, by exercise, a sudden blast of cold air, or even intense emotions like stress. The airway is just so on edge that almost anything can set it off. Because of that, managing asthma is really this two-part approach. First, you have your preventers. These are your daily maintenance meds, usually an inhaled steroid, that work to calm down all that background inflammation and make the airways less twitchy. Then you have your responders. That's your rescue inhaler, which you use during an attack to quickly open those airways back up. It's all about playing both defense and offense. Okay, now we really need to shift our focus here and our tone, because we're going to talk about conditions that affect the absolute most vulnerable among us: infants. This section is all about awareness, and it's all about prevention. So let's start with RSV. For you and me, RSV might just be a bad cold, but for an infant, it's a whole different ballgame. Their airways are so incredibly tiny that the swelling and mucus from this virus can be really dangerous. In fact, it's the #1 reason for pneumonia and bronchiolitis. That's inflammation of the tiniest airways in kids under 1 year old.
And that's why recognizing the signs is so, so important. Sure, it can start out looking just like a cold, a fever, a runny nose, a cough, but parents and caregivers have to be on the lookout for more serious signs, like wheezing, that high-pitched whistle sound when they breathe, or if the baby just isn't eating or is active as usual. Those are huge red flags.
And this leads us to, well, one of the toughest topics to discuss: SIDS, sudden infant death syndrome. The definition alone is just chilling. It's not an illness. It's what they call it when a death can't be explained, even after a complete investigation. It just happens, suddenly, to a baby who seemed perfectly fine.
And since we don't know the exact cause, everything, and I mean everything, is focused on prevention by creating a safe sleeping space. Campaigns like Safe to Sleep have made a massive difference. The rules are straightforward and they save lives. Always put babies on their backs to sleep. Use a firm, flat surface like a crib mattress. Keep the crib totally empty. No soft blankets, no bumpers, no toys. And of course, no smoke exposure.
All right, we have covered a lot of ground, from these long-term conditions in adults all the way to these critical risks for infants. So let's pull it all together and talk about the big takeaways, what this all means for breathing easier. And this table really breaks it all down, doesn't it? For COPD, the message could not be clearer. Your lifestyle is absolutely critical. Not smoking is the single most important thing you can do. For asthma, it's all about management, knowing your triggers, understanding your meds. It's a team effort. And for infant risks, the key is awareness. Awareness saves lives. Practicing safe sleep and knowing the signs of RSV, those are real, powerful actions for any caregiver. Think about it. We take over 20,000 breaths every single day. Our lungs just do their job, quietly, in the background. But after seeing just how fragile that whole process can be, the question we're left with is pretty simple. Are we doing enough to protect every single one of those breaths?